Hello, my name is Ryan Armstrong.
And this is Kim McNeil.
We are the auditors for the NC Medicaid EHR Incentive Program. Today we are going to discuss several helpful tips to assist you with preparing for an audit. We conduct audits to ensure that we have made an AIU or MU payment per CMS rules and regulations. When a provider is selected for audit, we email a records request letter to the contact email the provider has entered in NC MIPS when they originally attested. The records request letter explains the audit process and what information is required to complete the audit. You must respond within 15 calendar days and provide the required information, including patient-level documentation supporting your attested patient volume numerator and denominator, and the documentation required to prove that you have adopted, implemented, or upgraded to, or meaningfully used an ONC EHR technology. We may also ask for additional information as needed. As you know, providers must meet the required Medicaid patient volume threshold to be eligible to participate in this program. So we can verify patient volume. You will need to send patient-level documentation on an Excel spreadsheet to support the numerator and denominator that you attested to. The number of patient-level encounters you send for the numerator and denominator should reflect the encounters for your patient volume reporting period and should match the numbers reported on your sign attestation. The numerator includes only Medicaid encounters unless you are EP who practice predominantly at a FQHC or RHC, in which case the numerator also includes non-medicated needy encounters. The denominators include all encounters regardless of the payer. Health choice cannot be included in the numerator except by providers who practice predominantly at FQHCs or RHCs, in which case they are reported with non-Medicaid needed encounters. Also, pay close attention to make sure you're counting encounters and not claims as part of your numerator. An encounter is one patient with one provider on one day and may be different from the number of claims, because there can be multiple claims but only one encounter. Now, Kim is going to walk you through some examples and give you some helpful tips if you're audited.
Thanks, Ryan. This is an example of what your patient volume spreadsheet should look like. You must include the date of service and payer for all encounters reported. For your Medicaid encounters, you must include the patient's Medicaid ID number. If denied claims are part of your Medicaid enrolled zero pay, please be sure to give the reason why the claim was denied. When providing PV documentation, please be sure to review your attestation, which was provided along with the records request letter, to ensure that your information is accurate before submitting. The number of encounters on the spreadsheet you send should match the number of encounters reported on your signed attestation. In regards to CQMs, we are often asked, what do patient-level detail reports look like? Here's an example of what we're looking for. This report shows the CQM name, provider's name, numerator and denominator, patient's name, and date of service. Providing patient-level detail helps us verify that you met the CQM requirements. So, for example, if the numerator on your summary report is 13, we should expect to see a list of 13 patients. When submitting MU data, please be sure the attesting provider's name and date of service is shown on the screenshot and the reports. Here are some tips to avoid some of the common errors that we've noticed while conducting post-payment audits. Be sure you list Medicaid ID numbers for all Medicaid encounters on your PV report. Be sure the provider's name is shown on the MU documentation and the dates of service are within the provider's PV and MU periods. This information can be found on the records request letter and the signed attestation. It is very important that all PHI be sent via a secure source. This could be a password-protected document, or you could use an encryption program. The security risk analysis should be performed during the MU period which the provider is attesting. A pharmacy claim is not an encounter. An encounter is a unique patient on a unique day with a unique provider. It is very important that you review your documentation before submitting it to make sure you're providing the correct information. The person or entity that received the incentive payment will be responsible for returning that payment to the state in case of a failed audit. Please keep all documentation at least 6 years in case of a post-payment audit. Thanks for listening to our webinar, and if you have any questions, please send an email to ncmedicaid.hitinvestigator@dhhs.nc.gov.